Hi, good afternoon, everyone. Welcome to our webinar, Healthcare Talk, Cancer and You, which is organized by Soka Gakkai Malaysia. I am Dr. Chua, moderator for today's session. This health talk serves as a sharing of general knowledge for the public. If you have any specific situations related to you, your family, or friends, please discuss them with your doctors. Thank you for your kind cooperation. Cancer, a term which is no more a stranger to us, but is a disease that always concerns us. Sometimes we see the shadow of death whenever you hear this word. Therefore, let's explore further today about this disease. What are the causes of cancer? How shall we reduce the risk of getting cancer? And during the treatment of cancer, how should we take care of our diet? Without further delay, we are proud to invite two speakers from Soka Gakkai Malaysia to share this knowledge with us. The first speaker will be Dr. Ho Kian Fat, consultant oncologist. He had acquired his fellowship of clinical oncology in Belfast, United Kingdom. He has been working in Mount Miriam Cancer Hospital in Penang for more than 10 years. Our second speaker will be Ms. Crystal Ng, dietitian from National Cancer Society, Malaysia. She had acquired her master's degree in clinical nutrition in UPM. Let's invite our first speaker, Dr. Ho Kian Fat. The floor is yours.
Thank you, Dr. Chua, for the kind introduction. Thank you for the opportunity to share my talk today. I'm sure everyone here today would have heard of someone with cancer, or you may even have cancer yourself. Actually, what is cancer? A normal cell grows until it reaches a stage when it knows when to stop. However, when a cell's genes are abnormal, or what we call mutated, the cells fail to control itself and continue to grow uncontrollably, leading to too many cells, therefore forming a tumor. How do we know if you have cancer? For ladies, it is encouraged to examine your own breast, especially every month after your period. Please see a doctor if you feel a lump that is not normally there, or a lump that is growing in size. Please do not think that just because a lump is not painful, it is not cancer. A lymph node swelling in our neck can happen after a throat infection. If you feel that there is a lump in the neck that is growing or not going away, please consult a family doctor or an ENT doctor, the ear, nose, and throat doctor. We all have a pattern of bowel habits, which is very different for every single individual. If you have any unexplained change in your bowel habits, you need to seek medical attention. If you have a cough, normally it will improve after a few weeks or perhaps after a course of antibiotics. A cough that do not go away can be a sign of a problem in the lung. Some of us may be deliberately dieting to lose weight. However, if you have an unexplained weight loss, that again may be a sign of cancer. So a question to the audience today: how common do you think is cancer? What is the chance that a person will be diagnosed with cancer during their lifetime? 1 in every 10 person will be affected by cancer in their lifetime. So this is our Malaysian statistics. For breast cancer, the highest risk is seen in Chinese ladies, with a 1 in every 22 chance of having a breast cancer. Cancer is certainly increasing in Malaysia due to our aging population and much better access to healthcare and diagnosis. In this picture here, you can see that the top 3 most common cancer in men are colorectal cancer, lung cancer, and nasopharyngeal cancer. In ladies, breast cancer is by far the most common cancer in women, followed by colorectal cancer and cancer of the cervix. What causes cancer? Okay, so a question to our audience today: how many of you believe that the use of microwave can cause cancer? Do you think it's true or do you think it's false? So actually, it is false, that there is no evidence that microwave oven, the use of it causes cancer. However, this is a myth that actually quite a few still believe in. Another question to the audience. Okay, if someone has cancer, is that usually because there may be abnormal genes passed down from the last generation? Do you think it's true, or do you think that's false? Actually, it is false, because hereditary cancers passed down from generation to generation, they only form 5% or less of all cancers. So what causes cancer? I think you already know smoking is definitely one of them, but passive smoking is also very important and perhaps underestimated as a cause of cancer. Smoking is responsible not just for cancer in our lungs, but also in the cervix, in our bladder, in our mouth or oral cavity. Viruses can also cause cancer, although fortunately not the COVID-19 virus that we have so commonly now. Some viruses do have a vaccine, like the HPV virus, which causes cancer of the cervix, and the hepatitis virus that causes cancer of the liver. And fortunately, due to the vaccination, we are seeing much less of these cancers right now. Bacteria can also exist in our stomach, and one of it is called Helicobacter pylori, which can also cause cancer. Obesity is an increasing problem due to our modern lifestyle. We know that obesity is associated with cancer in our breast, in our womb, and the cancer of the colon. This is a very interesting study that showed that blood tests of workers in temples, they have very high level of carcinogen in their blood when they perform blood tests. Perhaps this is due to the long exposure to the inhalation of the incense smoke in temples. However, if it is a short exposure, especially in the open air environment, it is not a problem, so you shouldn't be too fearful of going. So studies shows that the risk of cancer in people who use incense to be low. However, in our house, if you use incense, it is good practice to have good airflow or ventilation. Asbestos is a very good material that is used in building ships. It's very good for insulation. Unfortunately, it can also cause a rare type of lung cancer. Fortunately, this dangerous type of blue asbestos is much less seen in Malaysia. The more common type of asbestos in Malaysia is white asbestos. The danger lies in the dust, especially when it is broken. If you're disposing it, especially broken pieces, please wear N95 mask and water down the dust to prevent inhalation, or even better, ask a professional company to help you deal with it. This is the list of things that I have drawn up as safe to use due to the many myths that exist. So you can see that it's a list of things that you can use. There is no evidence of causing cancer. And also, for example, the use of handphones, it has not been proven to cause cancer. So what can we do to prevent cancer? Question to our audience here. So if you have, we may have come across people who have a very healthy lifestyle, but yet develop cancer. Why is that? Do you think it's because they have very bad genes? Or do you think that living a healthy lifestyle is a waste of time? Or we don't know? What do you think? Actually, most of the time we don't really know the reason for an individual. But we do know that there are many triggers. For example, pollution, eating processed food, obesity, that may contribute to the cause. And it is likely that there is no single trigger. In addition, the longer we live, the more abnormal cells, genes or mutations that can happen or accumulate in our cells, leading to cancer. It is estimated that perhaps 1/3 of cancer death can be prevented if we take the right action and prevention. Most importantly, to stop smoking and to stop people around us from smoking. We need to increase our exercise and eat more fresh greens and vegetables. Processed food, especially our sausages, bacon, and lap cheong, have been proven to be carcinogenic. So therefore, it is advisable to reduce our consumption of processed meat. Our schools now routinely offer young ladies vaccination against the HPV virus, the human papilloma virus, to protect them against cancer of the cervix. it is encouraged that all ladies above the age of 40 years old to have an ultrasound or mammogram examination to screen for any breast cancer. A pap smear is also very important once every 3 years to screen for cancer of the cervix. So what are the treatment options that are available for cancer? I will now go through the treatment options and some case examples where there may be some pretty graphic images of cancer in its response, but I hope that it will help to share these in order to educate and to understand more about cancer and its treatment. So surgery still remains one of the main treatment for cancer. Chemotherapy is a cancer drug that is normally given as a drip or sometimes as a tablet. Breast and prostate cancers can be treated with hormonal treatment with a very good response. More recently, many patients have been receiving what we call targeted therapy and immunotherapy, which targets the cancer cells more specific and target the normal cells much less. So these produce a much higher response in the cancer cells with hopefully less side effects in our normal cells. In this picture of a patient, so this lady has a painful cancer of the salivary gland on the left side of her face. Radiotherapy and chemotherapy has unfortunately failed to control her cancer. She did try a new drug called immunotherapy, which fortunately controlled her cancer very well, as you can see in this picture, even after 3 years. Radiotherapy is a use of X-rays to destroy cancer cells and is increasingly more accurate with less side effects. In this picture here, you can see on the left, there is a cancer, a tumor on the tongue, which could not be treated with surgery. We offer the patient radiotherapy and chemotherapy to be given together, and fortunately, the patient responded very well and still remains very well to today with no further tumor in the tongue. Despite all the medical advances, we cannot escape the four sufferings of birth, aging, sickness, and death. For those whom we are unable to treat, we refer our patients for palliative care. So palliative care means the aim is to preserve the quality of life as best as we can and to reduce the symptoms that cause the patient the suffering towards the end of their life. Thank you very much for your kind attention today.
Thank you, Dr. Ho. After listening to the disease and treatment, then how about diet? Next, we shall invite our beloved dietitian, Ms. Crystal Ng, to share about diet during and after the treatment of cancer. She works together with oncologists closely, helping cancer patients plan their diet to regain health and improve recovery. Ms. Crystal, the floor is yours.
Thank you, Dr. Chua, for the kind introductions. Hello, everyone. This is Crystal. I appreciate the opportunity to share with you about nutrition for cancer prevention and treatment today. Okay. After a cancer diagnosis, people are very, very concerned about their overall well-being, and they are desperately want to know about nutrition. So when I see the patients in clinic, the common questions they normally ask is, what should I eat or not eat? Or what is the best food for cancer patients? So I believe that many people have received information from internet, their friends and family members. However, about 40% of them try unproven dietary strategies such as juicing, some restrictive diet or herbal remedies. Actually, confusions over what to eat and negative perceptions about food could eventually stop them from eating well during or even after the cancer treatments. They are also always being blamed for not doing good enough to prevent or treat cancer, especially if they do not follow the instructions. It's very important to get the right information about nutrition to ensure good nutritional status throughout the cancer journey. So today we are going to discuss about 5 common nutrition myths related to cancer. Okay, so the most common food that cancer patients always avoid is carbohydrate food. that thought eating food such as rice, noodles, cereals, and grains can actually feed cancer cells. So now the question is, should I eat this food? The answer is absolutely yes, because carbohydrate is the main energy source for all the body cells. For example, we will only have energy after eating rice, right? To prevent cancer, we encourage you to eat brown rice as compared to white rice, or wholemeal breads compared to white bread. Eating 3 servings of brown rice or wholemeal bread or oats every day can actually help to prevent colorectal cancer. So how about for those who are receiving cancer treatments? Actually, both brown rice or white rice can be your choice because they contain the same amount of energy. Some patients, especially those with nose, mouth, or throat cancer, they will have swallowing problems during treatments. In this case, white rice or white breads are more suitable because of the softer texture. You may have heard that sugar feeds cancer cells. Then cutting sugar and carbohydrate out of your diet will stop the cancer growth. This is actually a myth and can be harmful. Cancer cells actually are smarter than we are. They will still get the energy they need to grow from other body tissues, even if there's no sugar available. So bear in mind that healthy cells in your body also use sugar to survive. Therefore, if you remove sugar from your diet to starve the cancer cells, you are actually also starving your healthy cells, which you need to survive and continue and fight the cancer. So now your responsibility is actually to continue eating a balanced meal and not to simply restrict any type of food to make your healthy cells stronger to fight the abnormal cells. And forget about the cancer cells because we can't actually do anything. Just leave it to your doctor. Next, we are going to talk about fish and seafood. Many people say that fish, especially those without scales, and seafood contain toxin. So should I eat this? Yes, you should. A recent study actually compared the cancer incidence between the fish eater and also the meat eater. It shows that people eating moderate amount of seafood have lower risk of prostate cancer. And this could be due to other parts of the diet. For example, if you are eating more fish for your dinner, you may be end up eating less meat or animal food. Then you are able to control your body weight and also reduce the risk of getting cancer. And how about for those who are receiving treatments? As we know, fish and seafood are a source of proteins, which is very important for wound healing. So when your body doesn't get enough proteins, it might break down your body muscle for the energy it needs. This makes it takes longer time to recover from illness or treatment. So people with cancer often need more proteins than usual, especially after the surgery, chemotherapy, or radiotherapy. So therefore, extra protein is actually needed to heal the damaged tissue and to fight the infections. How about red meat? Should I eat red meat such as beef, mutton? Yes, you can. However, we advise people eat not more than 3 portions per week. 1 portion is equal to 1 palm size or about 500 gram uncooked weight. This is because excessive intake of red meat can increase your risk of developing colorectal cancer. And for those who are receiving cancer treatments, we do recommend you to eat red meats, especially during chemotherapy. This is because red meat actually rich in iron that can help you to produce red blood cells. Milk, I believe that milk or dairy are amongst the food that cancer patients normally avoid. It's actually worth for us to highlight this today. So should I should I take milk or dairy products? Yes, you should, because dairy products should be included as one of the main foods in our diet, because it rich in proteins and calcium, which is very important for the muscle and bone health. Research also show that taking 2 glasses of milk, here I would like to highlight is only low-fat milk, can actually help to reduce the risk of colorectal cancer. I believe that there are certain misconceptions about dairy, such as how it triggers the growth of cancer cells, or how the fermented dairy products are harmful, have stopped the patients or the people from taking dairy. Taking dairy can trigger the growth of cancer cells, either due to its hormone contents. Is actually a myth. In fact, no strong evidence shows that hormones and fermentations producing bacteria in milk or dairy products can actually cause cancer. We do recommend the patients who are receiving treatments to take milk, because most of the time they have poor appetite, they are very fatigued, they have swallowing or chewing problems during treatments, which can be a real challenge for them to finish their meal. So therefore, offering nutrition drinks can actually help them to gain energy without chewing. Here, I would like to highlight that those who are receiving treatments should actually choose pasteurized milk. Pasteurized milk that is treated by heat at a specific temperature for a period of time, which aims to kill the bad microorganisms or bacteria present in raw milk. This is to prevent any illness or infections in cancer patients who have weak immune response. As long as the milk is not taken directly from the farm, we allow the patients to drink it. Last but not least, should I eat tofu, tempeh, soy milk, or any soy products? Yes, you should, because soy and soy products are a good source of proteins, especially for vegans and vegetarians. An increasing number of studies actually show that soy intake can help to reduce the risk of breast and also prostate cancer. Soy foods besides meat, chicken, and fish are protein sources that can make a balanced meal. Tofu, an example of soy food, contains lesser amount of fat, which can be ideally used to substitute the animal proteins in our daily meals. This also helps us to maintain a healthy body weight and reduce risk of developing many types of cancer. For those who are receiving cancer treatments, we do recommend them to eat soy foods, because this is because soy or soy products are rich in proteins, which will help them to speed up their recovery after surgery or treatments. So now, let's look at the food here. Do you think you can eat this food like fried chicken or roti canai or French fries, ice cream and cake? For you, are they good or bad? Yeah, well, I would say it's bad because I can't even say no to this. I would say it depends. Yes, we can't deny that this food contains sugar and fat. However, there can be an easy way to get energy in less food for the cancer patients. So during cancer treatments, their appetite is actually greatly affected. I think everyone agree with me that it's very difficult to make them eat. So when they sometimes they might crave for this food, and when they do, we should allow them to eat. Otherwise, they will get very demotivated and don't feel like eating, and they will feel depressed. Eventually, they wouldn't want to continue the treatments. So in these slides, we notice that the food located at the left side, including fruits and vegetables, have the least amount of energy. We advise the general populations to eat more fruits and vegetables to control your weight and improve overall health. Now let's look at the right side. We notice that the food are actually with higher amount of energy as we move to the right. For people with cancer, we allow them to eat this kind of food, such as butter, fried noodles or chocolate, because this food can be the source of energy for the cancer patients during their treatments. Good nutrition is very, very important, starting from preventions to cancer treatments. You can actually follow the quarter, half concept by filling up your plates with half fruits and vegetables, quarter grains, cereals, and tubers, and another quarter with lean meat and fish. So as we know, being overweight or obese is clearly linked to increased risk of cancer. It's actually up to 13 types of cancer. So to reduce the risk of getting cancer, we should maintain a healthy body weight by adopting a healthy diet. Besides controlling the food portions, we should also reduce the intake of oil, margarine, animal fat, and skin, and also sugar in our diet. Remember, fiber is also very important. You may replace white rice with brown rice to get more fiber, and also choose plant proteins like soy products. They are lower in fat compared to the animal proteins. For people with cancer, we do not actually restrict the intake of sugar, fat, and salt. Just imagine you are only allowed to eat steamed fish every single day. I think you will feel bored, right? I can surely say that a monotonous diet is actually not sustainable. This is because it isn't just boring. It does present quite a high risk of nutrients deficiency. There is no one-size-fits-all approach when it comes to food. No single diet that works for everyone. Even identical twins, they process food differently. For general population, we want to be healthy. Therefore, we eat clean by cutting down sugar and fat to prevent cancer. But for cancer patients, what they wish is actually to survive from treatments. Yes, it's very important to feed them good nutrients, but we should also let them enjoy the food they like. If you have any eating issue during during cancer treatments, or you need to reduce your weight and you do not know what to do, you can actually talk to the dietitians. Yeah, I think I would like to end my presentations. Thank you, everyone.
Thank you very much again to Miss Crystal Ng. And now we will have our most anticipated session, the Q&A. Let's see what questions we have today. I hope both our speakers are getting ready to answer these tough questions. So the first questions will be to Dr. Ho. Are you there, Dr. Ho?
Yes, I can hear you.
All right. Once a cancer patient gets a relapse of his or her cancer, the survival rate will be very low because very likely the second time chemo will not working anymore. Is that true?
Yes, unfortunately, that's true. Whenever there's a relapse, the chance that we can salvage or to cure again could be low, depending on the stage and where it relapse. Treatment can only control, or what we call palliate or palliative, to control it for as long as we can. Unfortunately, that's true for most cases, but it's not exclusive. I think nowadays with more and more advances in treatment, even though, for example, if a tumor has relapsed in the liver or the lung, we do kind of discuss with our surgical colleagues, with other doctors, to see what we can do to remove those tumors to improve the control and prolong the patient's survival. And it is true that the more treatment you do, for example, chemotherapy, the more resistance that can develop, and treatment response is always best initially, and subsequently the treatment response will always be lower and shorter duration in the subsequent lines of treatment. True. Yeah.
So what you mean is early detection, early treatment will carries better survival rate overall.
Yes, of course. Yeah.
Yes.
Survival of cancer patients are determined by their stage and the type of cancer.
Yes. Thank you, Dr. Ho. Next will be to Ms. Crystal. People once said that if we are having early stage of prostate cancer, we can take some wine and cranberry juice, which may help us to recover. Is that true?
Is this directed to those who are receiving treatments?
It's not mentioned. Maybe you can cover
Okay.
both during treatment and
For
prevention.
preventions, right? Yeah. Actually, there are a lot of study actually saying that wine contains a lot of antioxidants, same as the cranberry. But if you want to use as a prevention method, it's still far away for us to do that. Yeah, we still need a lot of studies to support this. And for cancer, for those who are receiving cancer treatments, I would say because cranberries and also the nutrients that we get from wine is not the major nutrients that we need. The major nutrients that we need during treatments is still the proteins. It's still proteins that come from chickens, fish, soy products, milk, and also the energy that we need from the food. Yeah, it's not so much. It's not so much from the wine or the fruits. Yeah, or the cranberries. So yeah, I wouldn't say this can be the standard method for both prevention or treatment.
Yes, thank you, Miss Crystal. We are having quite a number of audiences asking about certain types of foods, whether they can cause cancer. So maybe in a lump sum, I help them to ask in short. Can keto diet, can alcohol, and also can keto diet and can alcohol cause cancer?
Okay, we talk about keto diet first. Keto diet is actually quite a popular diet now among the cancer patients. Some of the cancer patients, when they come to my clinic, they are actually practicing the keto diet because keto diet is a diet that eliminates all the carbohydrate food. They take a lot of fat and also proteins, and also the protein food. This diet is actually not balanced because it's missing out the carbohydrates, as we can if we can remember the quarter half concept during the presentations. So this kind of diet actually we don't advise to practice this in the long term, more than 3 months. There are certain patients, like for those patients who want to lose weight, sometimes we will advise them to go for keto diet, but not for cancer preventions.
Yes, thank you very much. So now another questions to Dr. Ho. Why after surgery that we resected the cancer or the tumor, and then the cancer re-emerge? Why this happened?
In many cases, unfortunately, the cancer may have already spread even before surgery. If the cancer cells are spread and they are very, very tiny, meaning just even a few cells, no amount of imaging or scan or PET scan can detect all these are small cells that may have spread. So after the surgery, for example, some patient may find a relapse of the cancer elsewhere 6 months later or a year later. So that is probably the most common explanation. The problem is that if it recurs 6 months later or 3 months later when you discover a spread, then patients may feel that, look, it's because of the surgery that has caused the cancer to spread. Okay, and unfortunately, in most cases, is the cancer has already spread before the surgery. However, we didn't detect it. So that led to a myth for people being fearful of surgery. If the cancer cell is quiet, why make it angry by cutting it away? So that caused people to fear the treatment rather than the cancer itself.
Yeah, then they may miss the opportunity to clear the cancer, right? Yeah. All right. So I might have my next questions. About antioxidant food. Does antioxidant food interrupts the chemotherapy or the immunotherapy treatment?
Okay, so I talk about the treatment aspect first, then maybe Crystal can add about antioxidant. Antioxidants are especially found in vegetables or fruits. There are many types. There has been some evidence to say that it helps to reduce the risk of cancer, i.e. prevent. But it's not a treatment for cancer, which people confuses with. So there are a lot of people who start taking antioxidants whenever they have a cancer. So this is not the right way, because antioxidants do not treat cancer. So it's a bit like being a vegetarian, which is good, or you want to be take organic food, which is good. So all those can be healthy in some individuals to reduce the risk of cancer. But again, it's not a treatment for cancer. You don't turn organic suddenly just because we have cancer. It's a bit like you stop smoking after you've got lung cancer. So I think you just want to correct some of the beliefs some people have. Antioxidants per se do not usually interfere with treatment. There are, however, some possible theoretical evidence that perhaps it may interfere with radiotherapy, because radiation works by causing what we call oxidation stress on the cells to kill the cells. So by having antioxidant, theoretically, it may interfere with the radiotherapy, not the chemotherapy. But overall, it is safe to eat your vegetables and greens as usual during treatment.
And how about Miss Crystal? What's your opinion about this antioxidant taking during the treatment?
Yeah, actually, antioxidants in general, is considered a good thing for us to take. But during treatments, because during treatments, again, this is not the nutrients that we really need, the major nutrients that we really need during treatments, because it doesn't provide you any energy. Yeah, antioxidant, it doesn't contain any energy or proteins for your wound recovery, for to make your body cells stronger to fight the cancer wounds. Yeah, so when we look into the study or the research, right, we do have some research actually saying that antioxidants might interrupt the cancer treatments, because what we know is antioxidants actually help to protect our body cells, right, from getting damaged, from getting hurt. But we are actually not really sure whether the antioxidants actually protect the cancer cells. This one we are not sure. So normally during treatments, we don't advise them to take antioxidants in a high amount or high dosage, because I found that most of the patients, when they started the treatments, they take a lot of antioxidants, come from the pill form or in a very concentrated form. So when we know that, definitely we will say no and just focus on you can get antioxidants, but from your regular diet. It's not from the supplements.
Yes, thank you, Ms. Crystal. So in short, antioxidant doesn't mean no, but you should have balanced diet and more on protein diet and high energy diet during your treatment of cancer, so to regain the recovery at the fastest pace, right? So next questions will be about colorectal cancer. Should I take more soft food to take care of my colon after I have this cancer? Ms. Crystal, please.
Okay, so for colorectal cancer patients, once they completed their surgery, normally we will advise them to take more liquid and also soft food first. Yeah, so because we worried that after the surgery, they will have some problems with digestions. So that's why we go for the liquid and the soft food. So after 1 month, or after 1 month, normally they can start to take their regular food already. Yeah, because if they are on this soft food diet for a long term, they are also at the risk of the nutrients deficiency. Yeah.
So again, it's about balanced diet, then also which type of diet that we can tolerate. So it's not about specific food that is particularly good for cancer treatment. So have this point bear in mind. Yeah. So next, I will have about, I see a question that's quite interesting to Dr. Ho. There's an audience mentioned about hydrogen peroxide. The food grade hydrogen peroxide can cure cancer or control the cancer. So by consuming hydrogen peroxide can cure or control cancer? This is a very serious question.
I do not know of any evidence that hydrogen peroxide can help the cancer treatment. Hydrogen peroxide is used mainly in, for example, like wound care to kind of like sterilize wounds. It kills bacteria and so on. This is my limited knowledge, but it's not a routine use for cancer treatment, and I suppose ingestion of it might even be potentially dangerous. So I do not know of any evidence that it helps.
Yeah, and I agree. As an emergency physician, I will strongly advise you not to take it. It's a toxic bleaching agent, and you may end up perforate your throat, your stomach, or even your lungs may inflame. So it's not a treatment for cancer. Yes, please bear in mind. So next, how about some Chinese medication and modern medication? How can we combine both together for the cancer treatment? Maybe I shall portray these questions to Miss Crystal.
Okay, so regarding some of the patients actually will take Chinese medicines when they are started the treatments because they believe that Chinese medicine can actually improve the recovery process. Yeah, but again, when they are starting their modern treatments, like the conventional treatments, normally we will ask not to simply take the Chinese medicines because some of the Chinese medicine actually can increase the risk of bleeding. So after the surgery, we want the patients to actually recover faster and to reduce and to minimize the risk of bleeding, right? Yeah, so there might be some contraindications. But however, there are few hospitals, I think Institute Cancer Negara, the National Cancer Institute Purajaya, and also Tongshin, they are having the TCM department also. Yeah, basically to relieve their symptoms. Like for example, some of the breast cancer patients, they will have swelling on their arms. So they will use the TCM to help and relieve the swelling and also the pains. Yeah, I would say more on the quality of life.
Yeah, thank you, Ms. Crystal. Due to the limited time, we would conclude our Q&A session today. Thank you very much for your enthusiastic response. If your questions were not being selected, 1,000 apologies for the inconvenience. Let's offer a hearty applause to our two speakers who have been answering our questions with such great patience. Thank you again to Dr. Ho and Ms. Crystal Ng. I believe everyone with us has harvested such great knowledge today. There is a wise saying that goes as follows: illness gives rise to the resolve to attain the way. Cancer is not an apocalypse, but it is the opportunity to reflect on ourselves, to remind ourselves that our lifetime, which is so limited, is ticking. Therefore, we have to live our lives with even greater responsibility in taking good care of our health and well-being. During the course of cancer treatment, we shall consult with our doctors and work together with them while we are also optimizing our nutrition intake. And last but not least, we should manifest our wisdom and unlimited life force to fight against cancer. Such multiple approaches will ensure the best outcome of the treatment, isn't it? Thank you very much for your time spent together today. Bye-bye. Thank you very much.